Welcome back, and here is a health informatics data and AI talk focusing on the ethical considerations surrounding generative AI in healthcare.
Definitely a hot topic these days.
Yeah, for sure.
And you sent over this research review for 24.
Yeah.
I'm really curious to kind of unpack this with you.
Yeah.
Because it really looks at this rapidly evolving tech and even proposes a checklist for researchers.
I was really intrigued by that checklist.
Yeah, it's interesting, isn't it?
Yeah.
This research is emphasizing that we need to think beyond just,
The usual suspects,
Yeah.
like ChatGPT.
Right, exactly.
And we talk about ethics.
Yeah, we need to consider all sorts of generative AI,
The whole spectrum.
including those creating images and structured data.
So it's not just about, chatbots
Right.
spitting out medical advice.
Exactly.
We need to be looking at the bigger picture.
Exactly. Different types of generative AI raise their own specific ethical questions. For example, think about the difference between text-based generative AI, like ChatGPT, and AI that generates images or structured data.
Okay, I'm all ears.
So what kinds of ethical considerations are we talking about here?
Yeah, what kinds of ethical considerations are we talking about here?
Well, with text-based AI like ChatGPT, you have concerns about patient autonomy. People relying on a chatbot
Right.
for medical decisions.
Without a doctor involved.
Without a doctor involved.
Yeah.
And then there's the issue of misinformation.
Yeah.
A chatbot providing inaccurate medical advice.
Oh, yeah, that's a worry.
That does sound worrying.
Yeah, so what about
the AI that creates images or structured data?
what kind of ethical challenges do they present?
Those focus more on privacy and data security.
Okay.
For example, imagine someone using AI to create fake medical images for insurance fraud.
Ooh.
That's a whole new level of concern.
Yeah, it sounds like generative AI can be a double-edged sword.
Absolutely.
What really stood out to me this review was the point about how AI can be used to solve problems,
Right.
but also create new ones.
Absolutely. It's a bit of a paradox.
Yeah.
On one hand, researchers are using generative AI to create synthetic data sets
Right.
that mimic real patient data, but without containing any identifiable information.
Okay.
This is an attempt to address privacy concerns while still allowing for research and analysis.
Okay, so that's ingenious.
Right.
Protecting patient data is crucial,
Absolutely.
especially with all the advancements in AI. But like you said, there are two sides to every coin.
Right.
What are the potential downsides to using synthetic data?
Well, one concern is that biases can creep into these synthetic data sets.
Okay.
And if you're using biased data to train AI algorithms,
Right.
you're likely to end up with biased results.
Yeah.
That can have serious consequences, especially in healthcare.
Yeah, for sure.
It seems like we're constantly trying to stay one step ahead.
Yeah. Is there a way to ensure that these systems are being developed responsibly?
Well, the authors of the review point to a lack of consistency in how researchers define and discuss ethical principles.
Okay.
This lack of a shared language and framework can make it really difficult to have productive conversations and develop effective guidelines.
So we're all speaking different ethical dialects, so to speak.
Right.
How do we bridge that gap?
That's the million-dollar question, but the review does offer a potential solution, something called the TREGAI checklist.
Okay, that's piqued my interest.
Uh-huh.
What is the TREGAI checklist, and how does it work?
It stands for Transparent Reporting of Ethics for Generative AI.
Okay.
It's essentially a tool designed to encourage researchers to systematically and rigorously consider ethical implications throughout the entire research process,
Yep.
from data collection and algorithm development to testing and deployment.
So it's like a guide to ethical due diligence for anyone working with generative AI in healthcare.
Exactly. They envision this checklist being used by journals, review boards, and even funders to ensure that ethical considerations are baked into every stage of research and development.
It sounds like a step in the right direction,
Yeah.
especially given how quickly things are changing in the world of AI.
Absolutely.
But with generative AI evolving so rapidly, how can we make sure the checklist stays relevant?
That's where it gets even more impressive. The TREGAI checklist is designed to be a living document,
Okay.
constantly evolving and adapting to new ethical challenges and our growing understanding of generative AI.
Right.
It's not meant to be a static set of rules, but a dynamic framework that can guide us through this complex landscape.
That makes a lot of sense. We're talking about uncharted territory here.
Right.
And we need adaptable tools to navigate it.
Absolutely. And this leads us to an even more mind-blowing aspect of this research, the emergence of what they call multimodal Gen AI.
Multimodal, okay.
This is AI that can combine different data types,
Okay.
text images, even brain activity
Oh,
to
got it.
create even more powerful and sophisticated models.
Hold on, brain activity.
Yeah,
That sounds straight out of science fiction.
it does, doesn't it?
What are the implications of that?
It opens up incredible possibilities.
Yeah.
But it also raises some serious ethical questions.
Like,
The review mentions researchers working on technology that can reconstruct images or text from brain activity.
reverse mind reading. What are the ethical concerns surrounding that?
Well, for starters, it raises significant privacy concerns.
Yeah.
Imagine the potential for misuse if this technology falls into the wrong hands.
Right.
Could it be used for coercive interrogation or even thought manipulation?
Wow.
These are questions we need to be asking now before this technology becomes even more widespread.
This is all incredibly fascinating, but it also feels a little overwhelming. Where do we even begin to address these ethical challenges?
It's definitely a lot to take in, but I think the key takeaway here is the importance of having open and honest conversations about these issues. We need to bring these concerns to the forefront, engage with diverse perspectives, and work collaboratively to develop ethical frameworks and guidelines that can keep pace with this rapidly evolving technology.
So it's not just about developing new technologies, but also about developing our ethical understanding and frameworks alongside them.
Precisely. We can't just focus on what's possible. We also need to think carefully about what's permissible and what's desirable.
That's a really important point.
It is. You know what strikes me is how this research emphasizes that generative AI is not just one thing. It's a whole spectrum of technologies with different applications and ethical implications.
Right, like we were talking about earlier.
Yeah.
It's not just chatbots giving medical advice.
Exactly. Some researchers are using generative AI to tackle those data privacy concerns we discussed.
You mean by creating those synthetic data sets?
Yeah.
Where AI generates data that looks like real patient information, but without any identifying details.
That's right. It's a way to protect privacy while still allowing valuable research.
That's pretty clever. But the research review also highlighted how different types of data, like text versus images, come with their own sets of ethical challenges.
Absolutely. Take text-based generative AI like ChatGPT. There are concerns about patient autonomy. Could people start relying on these chatbots for serious medical decisions without ever consulting a human doctor?
That's a scary thought. And what about the potential for these chatbots to spread misinformation?
That's another big concern. A chatbot could easily generate medical advice that sounds convincing, but is completely inaccurate.
Yeah, it's like how some people blindly trust information they find online.
Right.
Without checking the source. But with AI, that problem could be amplified.
Exactly. Then with image-based generative AI, you have a different set of concerns. Think about the potential for creating fake medical images.
Like creating fake x-rays or scans for insurance fraud.
Exactly. Or even worse, imagine someone using AI to manipulate real images to misdiagnose someone. It's a whole new level of potential harm.
Yeah, it sounds like a digital version of tampering with evidence.
And it gets even more complex when you consider what the researchers call multimodal generative AI.
Multimodal.
This is AI that can combine different data types, text images, even brain activity to create even more powerful models.
Wait, hold on. Brain activity. You're talking about AI that can read minds.
Well, not exactly read minds, but the review mentions researchers working on technology that can reconstruct images or text from brain activity patterns.
That sounds like something out of a science fiction movie.
It is pretty mind-blowing, isn't it?
Yeah, what are the ethical implications of that?
On the one hand, imagine the possibilities for diagnosing and treating neurological conditions.
Yeah.
But the potential for misuse is also huge.
What kind of misuse are we talking about?
Imagine this technology being used for coercive interrogation or to manipulate someone's thoughts. It raises some really profound questions about privacy and autonomy.
It's like the ultimate invasion of privacy, someone being able to access your thoughts without your consent.
And that's exactly why this research review is so important. It's a call to action for the healthcare community to start thinking about these ethical dilemmas now before they become even more complex and difficult to manage.
It sounds like we need to develop new ethical frameworks and guidelines.
Absolutely.
To keep pace with these rapid advancements in AI.
Absolutely. And the researchers behind this review propose a tool called the TREGAI checklist as a potential starting point.
We talked about that briefly in the first part of our deep dive.
Right.
Can you remind us what the TREGAI checklist is all about?
It stands for Transparent Reporting of Ethics for Generative AI.
Okay.
It's essentially a set of guidelines designed to help researchers systematically consider the ethical implications of their work at every stage of the process.
So it's like a roadmap for ethical AI development.
That's a great way to put it. It prompts researchers to think about things like data privacy, potential biases, the risk of misuse, and the broader societal impact of their work.
It sounds like a valuable tool, especially given how quickly the field of AI is evolving.
And here's the key. The TREGAI checklist is designed to be a live document.
So it's not just about focusing on the technical aspects of AI development.
Right.
It's about recognizing the human dimension, the ethical implications, and the societal impact of these powerful technologies.
Exactly. And that's where the TREGAI checklist can play a valuable role. It helps to bring those ethical considerations to the forefront and to ensure that they're not overlooked in the rush to innovate.
It's about building ethical guardrails into the very foundation of AI development.
That's a great way to put it. We need to ensure that these technologies are developed and used in a way that aligns with our values and serves humanity, not the other way around.
This conversation has been really insightful. What are some of the key takeaways you'd like our listeners to keep in mind as we continue to explore the world of generative AI in healthcare?
I think the most important takeaway is that we need to approach these technologies with both excitement and caution. Generative AI has the potential to revolutionize healthcare in countless ways, but it also comes with significant ethical challenges that we need to address proactively.
It's about embracing the possibilities while also being aware of the potential risks.
Exactly. And it's about recognizing that this is not just a technical issue, it's a deeply human one. We need to have open and honest conversations about the ethical implications of these technologies and work together to ensure that they're developed and used in a way that benefits everyone.
This has been a great overview of the ethical landscape of generative AI in healthcare, but I'm curious to hear more about how these ethical dilemmas are playing out in real-world settings. In the last part, we were talking about how these ethical considerations around generative AI are playing out in real-world settings.
Right.
Have you come across any interesting examples?
Definitely one that comes to mind is a hospital that was using AI to analyze patient data and predict the likelihood of readmission within 30 days.
Okay.
The idea was to help identify patients who might benefit from additional care or support after being discharged.
That sounds like a really helpful application of AI.
Yeah.
Proactive care can make a big difference in preventing complications.
You think so, right? Yeah.
But here's the catch. The AI model they were using was found to be biased against certain demographic groups.
Oh.
It was flagging them as high risk for readmission, even when their medical records didn't necessarily support that assessment.
So even with the best intentions, AI can perpetuate and even amplify existing societal inequalities if we're not careful.
Yeah, it's a really important point.
It's like we've encoded our biases into the algorithms.
That's a key takeaway from this example. It highlights why it's so important to carefully evaluate these AI systems for fairness and equity.
Right.
Before deploying them in real-world settings, we can't just assume that they're objective or neutral.
It seems like the TREGAI checklist we discussed earlier
Right.
could be really helpful in addressing these kinds of issues.
Absolutely. Remember, the TREGAI checklist encourages researchers to think about potential biases in their data and algorithms. And to develop strategies for mitigating those biases, it's about building fairness and equity into the design of these systems from the ground up. It's like having an ethical compass to guide us through the uncharted waters of AI development and deployment.
Yeah, I like that.
So we've talked about the checklist in general terms.
Yeah.
But can we get a little more specific? What are some of the key principles it covers?
One of the core principles is transparency.
Go ahead.
The checklist encourages researchers to be open about how they've developed and trained their AI models, what data they've used, and what steps they've taken to address potential ethical concerns.
That makes sense.
Yeah.
Transparency builds trust.
Right?
And allows for greater scrutiny and accountability.
Exactly. Another important principle is accountability.
Okay.
The checklist emphasizes the need to clearly define who is responsible for the development, deployment, and potential consequences of these AI systems.
Correct.
It's about ensuring that there's someone who can be held accountable if something goes wrong.
So it's not just about creating these powerful technologies.
Right.
It's about using them responsibly and being prepared to answer for the consequences.
Precisely. And that responsibility extends beyond just the individuals who create these systems.
Okay.
The checklist also encourages researchers to consider the role of institutions, organizations, and even governments in ensuring ethical AI development and use.
It's about creating a whole ecosystem of responsibility where everyone involved understands their ethical obligations and is committed to upholding them.
That's a great way to put it. And remember, the TREGAI checklist isn't just a static document.
Right.
It's a dynamic framework that's constantly evolving to keep pace with this rapidly changing field.
That adaptability is so important. As we've seen, the ethical landscape of AI is constantly shifting.
Right.
As new technologies emerge and new challenges arise,
Yeah.
we need tools that can evolve alongside those changes.
I completely agree. And the TREGAI checklist provides a really valuable framework for navigating this complex and evolving terrain.
This whole conversation has been incredibly insightful.
Mhm.
It's clear that generative AI has the potential to transform healthcare in profound ways. But it also comes with some really big ethical challenges that we need to be thinking about carefully.
I couldn't agree more. It's not enough to just focus on the technological advancements.
Right.
We also need to engage in a deep and thoughtful conversation about the ethical implications of these technologies and work together to ensure that they're used in a way that benefits humanity as a whole.
This is a conversation that needs to involve a wide range of voices, researchers, developers, healthcare providers, policymakers, ethicists, and most importantly, the patients whose lives will be directly impacted by these technologies.
Exactly. We all have a stake in shaping the future of AI in healthcare.
And that future is being shaped right now with every decision we make, every line of code we write, every conversation we have about the role of AI in our lives.
This is a defining moment in the history of medicine and technology. And the choices we make today will have far-reaching consequences for generations to come.
That's a powerful thought. So where do we go from here? What can our listeners do to get involved in this conversation and help ensure that AI is developed and deployed ethically in healthcare?
First and foremost, stay informed. Keep learning about the latest developments in generative AI and the ethical challenges they present. There are tons of resources available online, and organizations like the Lancet Digital Health are doing great work in this area.
It's about becoming an informed and engaged citizen in the age of AI.
Exactly. And don't be afraid to ask tough questions if you're a patient. Ask your doctor how AI is being used in your care if you're a citizen. Demand that your elected officials prioritize ethical AI development. And if you're a researcher or developer, make sure you're incorporating ethical considerations into every step of your work.
It's about holding ourselves and each other accountable.
Absolutely. And finally, remember that the future of AI is not predetermined. It's something that we create together through our choices, our actions, and our willingness to engage in these critical conversations.
This has been a fascinating and thought-provoking deep dive into the world of generative AI in healthcare. Thank you so much for joining us today and sharing your insights.
It's been a pleasure, and thank you for having me.
To our listeners, we encourage you to continue exploring these issues and to join the ongoing conversation about the role of AI in our lives. The future of healthcare, and perhaps even humanity itself, depends on it.